Welcome to the Dental Business Guide podcast. From money to marketing to management, this podcast will help you run a better dental business.
Hello, this is Dr. Smita Mehra. Today I'm going to talk about concerns meetings for staff. So you're in a situation where you're a little bit disgruntled by a certain member of staff. Let's take a nurse, for example. She or he is not pulling their weight. You've had a couple of meetings. You've discussed things. The dentist or the associate or the practice managers also discussed things. Things haven't really moved along in the right direction, and you want to take it further. You want to pull in a disciplinary, or you get maybe some attitude back from the nurse saying, I want this, and yet you're thinking, well, yes, but you haven't corrected that. And so how can I give you, for example, more hours? And they might demand more hours, and they might say that you've promised more hours, but actually what you're finding is that certain members of staff aren't getting along with them, or they're just not learning, or they just have an attitude. And in fact, what you want to do is reduce their hours or eliminate their hours, and they want you to increase them, and they don't understand why you're not doing it. So the biggest tip I have here is one of the things you must do, whether you have a concerns meeting or whether it's a full-on disciplinary, and there is a process for disciplinary proceedings, is that you must follow up a meeting of any sort with an email, or at least written evidence, in a letter or an email or whatnot, so that there is written evidence and proof that you had that meeting. Because I see so often, and I've made the big mistake myself through the years, is I've had certain meetings with dentists as well, where performance has been less than desirable, and I've discussed things on many occasions and things just haven't really improved. And then, I've had to take things further. They become very disgruntled or want to take things further on a legal standpoint, from a legal standpoint. And the simple reason is that I've either been left out in the cold because I've not made any notes or not written any emails. I just thought it would be a nice casual meeting. Didn't want to make it sound too stressful or too serious. And I've had the same with my practice managers as well. And what ends up happening is this whole sort of casual, friendly approach comes and bites us in the bum. So my advice there would be always, whatever kind of meeting you have, certainly if it's any kind of concerns meeting, always back that up with an email. Even if it's a bullet point to say, listen, there were A and B involved in the room. A said the following, B responded with the following, and then the follow-up or the conclusion to that was X, and the follow-up is Y in 1 week, 2 weeks, whenever it is. So that there is, and send them a copy, keep a copy yourself. Obviously, a disciplinary is slightly different, and there are procedures to carry out disciplinaries, but I'm just even talking about concerns meeting. Everything you do, make a note and make sure that there is written evidence of it.
Thanks for listening in to the Dental Business Guide podcast. We welcome your feedback, and if you're enjoying it, please let your friends know too. Until the next time on the Dental Business Guide podcast.